will tell you how to describe X-ray picture. Remember, for example, I try to describe this, let's say, I should tell, first of all, mandible. In side projection, we can see defect of the bone tissue, line form in the angulus of the mandible, size 1 millimeter to 4 centimeters. With ровные края in English.
Crown, neck.
One moment, I will. Ровные края. С ровными краями и четкими контурами перевести на английский.
With smooth edges and clear contours.
With smooth edges and clear contours. Smooth edges and clear contours. Ровные края in Russian, четкие контуры. If we have clinical symptoms, for example, the patient showed us trauma 1 day ago, and edema, and any other symptoms of the fracture, we can see that in this situation we can give diagnosis. Traumatic open fracture of the mandibular in angulus, left side, left or right? Left, L, Russian literal L, left side. Did you understand? First of all, describe, after that, diagnose. Traumatic angulus fracture of the mandibular, full open fracture of the mandibular, left side. This is a full diagnosis using X-ray picture and clinical symptoms of the fracture. Try to describe your pictures. I will. In case of trauma of maxillofacial area, which you should solve in your future work, this is the answer of the question: presence fracture of the mandibular or maxilla, or maybe only trauma of the soft tissues. How to understand? There are, of course, a lot of things which can be in case of fracture of the mandibular or maxilla and in case of trauma of maxillofacial area. But there are several symptoms which can be only in case of fracture. First of all, objective symptom of the fracture of the mandibular. More often we will deal with trauma and fracture of the mandibular. 95% and only 5% maxilla, fracture of maxilla. What's the objective symptoms? The main objective symptoms: pathological mobility. What does it mean, pathological mobility? Mobility in place, for example, here or here, where this mobility cannot present in normal situation. No, for example, fracture here. We can take the mandibular and try to very carefully shift up, down, and we can see the mobility here. And during our manipulation, we can hear special sound. The sound is named crepitation. You may hear. This is the second objective symptoms of the fracture. Disposition of the bite. For example, tooth and understand? The shift of pieces. And very, very effective, sometimes maybe fracture without disposition, without shift the pieces of bone. We can use probe. Probe is direct or non-direct pressure. For example, non-direct pressure. We ask patient open them up and press here on the mental area. And the patient tells us, doctor, you press here, but I feel pain. For example, here. Why? Why? Yes, the patient feels pain in fracture line. Or for example, maybe press or maybe pull, тянуть. And say, oh doctor, I feel pain here, or here, or here, or here. Why here? Почему здесь? Because there are 4 typical places of the fracture of the mandible. The first place, angulus of the mandible. Here. Second place, foramen mentale. We can see fracture line here. Third place, middle line. And finally, processus articularis. If you try to find fracture of the mandible, you should find in these places. First place, second place, third place, and fourth place. But if the military trauma or accident, maybe another situation. In typical situation in our country, pach, or down. This is a typical situation, and we can see fracture here. And if you see X-ray picture, see first of all these places for fractures, because sometimes we cannot see X-ray picture. We cannot have possibility to do X-ray picture. X-ray picture to confirm our diagnosis. Of course, if we, for example, cannot see the normal situation in X-ray picture, no pathological situation in X-ray picture, we can do computer tomography. Computer tomography we can do in 3G projection. Now I feel I can show you the computer tomography. No, for example, here, not here, next, oh, here. So I try to. Do you have your group in Viber or in Telegram? Yes. WhatsApp. Give other students and try to find pathology. This is a computer tomography, and you should find pathology. And now I feel.
Yeah.
Try to find. And 3G projection. I will give you 3G projection. It's not 3G, it's the horizontal position. Now I try to find 3G. No, 3G very easy for you. But now. Who finds the problems?
Posterior wall of maxillary sinus is broken.
Yes, correct. Other students cannot understand and cannot see, of course. Sinus maxillaris, 3 walls fractures, yes, and arcus zygomaticus. All students see.
Yes.
Now I will send you the 3G projection, and you make 3.
This part.
Yeah.
Yeah.
This and winning, yeah.
3G projection, but I cannot.
I see the differentiate and see both.
You should find the problems. Find the problem. Did you find? Did you? Did you получать? Учили?
No.
No?
Yes.
Yeah.
Мгм.
1, 2. Previous 2. Короче.
Very good. Yes, and yes. Middle line.
Angle, right?
Yes, correct. It's a typical place. Middle line and angle of the mandible.
Middle. Right.
No, because it's such projection, it's normal. Orbital no projection. So, what you should do in case of fracture? Remember three main steps. Because the class is finished, we should go to the next class. Step number 1. What you should do in case of fracture of the mandible? You should give pain killer drugs. First of all. Step number 2. You should do immobilization. How to do it? Dressing. Temporal submental area, submental dressing. We fixate mobility mandibular to unmobility maxilla. And step number 3, go to maxillofacial surgeon, to surgeon stomatologist. Very easy, but unfortunately our doctors didn't do immobilization. The patient go to the specialist and what can be the pieces of bone, the shift and the blood vessels and nerves damage. It may be bleeding, maybe problems with sensitive innervation. Sometimes muscles put between the pieces of bone and this fracture cannot consolidate. This is the interposition of soft tissue between the pieces of bone. That is why very easy, drug immobilization. And of course after that what we should do? We use splints. Splints by who is author of this splint? Splint by Tigerstedt. Special, in Russian we say проволока. How to fixate? We do close reposition, close them up, and use special resin rings. And the one and the edge fixate. Understand?
Like for the piercing.
How long? 3-4 weeks. How to eat? How to eat? Drink liquid food without any tubes. In the vestibulum, from vestibulum behind the wisdom teeth. Enough place to go the food from the vestibulum into the oral cavity without any tubes. Meat, vegetables, fruit, but fluids. 3 weeks. Unfortunately, our patient go home, remove the rings, and begin to eat meat. And the mandibular, unfortunately, the patient very quickly puts the resin rings and go to the doctor. I don't know why. I never do. I don't know why the problems in my
И он
mandible.
пахнет как процесс настойки.
Yes. Это anesthesia by spiritus etylicus 40% concentration. Very, very effective for our patient. Well. So, do you have any questions? No questions. Next class. Tumors and tumor-like conditions. Your pictures.
Here?
Yes. No. Where is the practice part?
Here. This part. Under the wisdom tooth.
Very.
Under the wisdom tooth.
Вот.
И
Yes.
я?
Да. Under the wisdom. Behind the wisdom.
behind.
Hangi ben çok beğendim?
Mandibular.
അവരെ പറഞ്ഞു
അവര് മനുഷ്യൻ താനേ
This mandibular. The fracture. And this special splint fixation. Вот. It's a side projection. Side projection. Боковая проекция, but
People are.
if we drew X-ray picture, we can use zoom the left side and right side. That is why we should наклонить голову and to do only one part of the mandible. Yes, under mandible and the wisdom tooth inside the infractus lines. We should remove this tooth because this is the door to infection. Portal for infection. Yes, correct. Also the wisdom tooth, but retention wisdom tooth inside the fracture line. Unfortunately, very difficult, but we should remove this tooth to treat. No, very easy. Where is fracture? No. Here. The problem, this is the problems with mandibular. 1, 2, 3 pieces of bone. Maybe defect of the bone tissues and many fractures line. Severe trauma, maybe accident. This is a foreign body inside the nose. Foreign body. Yes, a fracture near the wisdom tooth. And the wisdom tooth is the fracture line. We should remove this wisdom tooth.
Doctor, this is the fracture.
What? This is fracture. No, we will see the fracture of the mandibular here. Yes, this is a fracture. It's normal. The vertebra plus skull. That is why what? This is the fracture of the mandibular.
See, it's here, right?
Only here? Yes, only here.
This one was fracture.
Fracture. One line, two second line.
Show me. Any foreign body?
One second line. Two parallel.
One practical skill by the radiation and one by the environmental design. You answer both questions. For example, how this determine temperature, relative humidity, and speed of air movement. This is environmental design. And gamma radiometer, EKG, AT1320. This is radiation medicine.
And do you have anything to say about the disease?
Yes, you should say complaints, you should say how doing, work performance, normal value, and name of the disease.
Thank you.